All right, so today, we're diving into healthcare's digital lifeline. We're talking about those incredibly complex IT systems that, keep our hospitals actually running. But we're also going to look at the constant, ever-present threats that could snap that lifeline in a heartbeat.
It's a simple idea, but it's a really profound one. Think about it. From your patient records to the diagnostic tools, all the way to telemedicine and even the surgical equipment in the OR, the software running in the background, it's just as vital now as a surgeon's scalpel or a doctor's stethoscope. It's not an exaggeration.
So that's the big, scary question, right? Because when these systems go down, and it could be from anything, a simple glitch, a storm, or a full-on cyber attack, the consequences aren't just inconvenient. They can be absolutely catastrophic.
Okay, so to really get a handle on the risk here, we've got to first appreciate just how deeply these digital systems are woven into everything in modern healthcare. Just think about the sheer scope of it all. You've got electronic health records, scheduling, billing, all the communication flying between departments, even the machines monitoring a patient's vital signs. It's all running on one single massive interconnected network. And look, this isn't just about making things easier. This is absolutely essential for providing care without interruption. Any downtime, even for a short while, can directly, and I mean directly, put patient safety at risk. So, the big question is, how do you even begin to prepare for the worst-case scenario? Well, let's take a look at a real-world stress test that pushed a major city's hospital system right to the edge, on purpose.
So, picture this, Paris, July 5th, 2023. With the 2024 Olympics on the horizon, the city authorities decide to run a massive 24-hour drill. The whole point? To see if their emergency plans could actually hold up against a full-blown ransomware attack. And let me tell you, what they discovered was pretty alarming.
The first thing to completely fall apart wasn't some high-tech piece of medical gear. Nope, it was communication, the most basic, fundamental part of handling any crisis. Suddenly, without their normal digital tools, just trying to coordinate between different departments in the same hospital became a huge mess. Getting outside help? Forget about it.
And that just uncovered the next huge problem. Everybody had different priorities. You had the clinical staff, totally focused on the patients right in front of them. Then you had administrators, worried about keeping the lights on. And then managers, trying to strategize. It was pure chaos. And it left the poor IT teams who were trying to fix the actual problem getting pulled in a million different directions.
And here's the thing that we so often forget, the human element. Right in the middle of this crisis, even the most experienced leaders were just drowning. They were getting slammed with information, paralyzed by stress, and they just couldn't keep their heads above water with all the problems popping up.
So here's the really crucial takeaway. Instead of actually following a clear strategy to get things back online, the leadership was just stuck playing whack-a-mole, putting out one fire after another. They were just reacting, never getting ahead of the curve. And what did the simulation prove? That just having a plan written down somewhere is nowhere near enough.
Now, this kind of weakness, it's not unique to Paris. Not at all. This is a recognized problem all across Europe. And that's exactly why regulators have stepped in with a major new law designed to basically force everyone to up their game.
So, let's talk about the NIS2 directive. This is the EU's big answer to this growing threat. And to be clear, this isn't some friendly suggestion. It's a law and it has real teeth. The goal is to create a single, high standard for cybersecurity for everyone, all across the EU. So, you might be wondering, how's this different from the first NIS directive? Well, for starters, the scope is way, way bigger. It's not just about essential sectors like energy and healthcare anymore. Now it covers important sectors too. We're talking everything from food production to scientific research. Plus, the rules are tougher, reporting incidents is way more strict, and there's a huge new emphasis on countries working together. The bar has been raised big time.
Okay, but let's be real. Passing a law is one thing. Actually getting everyone to comply with it? That's a whole other ballgame. So why is this so incredibly hard for organizations to get right?
Well, research points to a few major roadblocks. The biggest one, number one on the list, is just a lack of awareness. A lot of organizations just don't really get what they're supposed to do. Right behind that, you've got the usual suspect, not enough money. Then there's the massive technical headache of updating ancient systems. And to top it all off, there's a huge global shortage of people who actually have the skills to do this work.
Yeah, let's zoom in on the money problem for a second, because this is really telling. A survey from 2024 found that 68%, more than two-thirds of organizations, aren't getting new funding for this. Instead, they're just pulling money from other departments. So cybersecurity is literally having to fight for scraps with other critical needs. And we all know what that leads to, right? Cutting corners.
And the people problem? Okay, so check this out. As of 2023, there were 5.5 million cybersecurity pros around the world. I know, that sounds like a huge number, but the demand is growing so ridiculously fast that there's still this massive, gaping hole. There just aren't enough experts to go around, period.
And here's the kicker. These problems aren't happening in a vacuum. They're all connected. A recent study actually mapped it out and found this clear cascade effect. Think of it like a row of dominoes. It all starts with that lack of awareness. That first domino falls, knocking over the next one. Not enough resources. That makes it impossible to deal with the technical problems, and boom, the final domino is operational failure. One thing leads directly to the next.
And this quote from a hospital's chief information security officer, man, it just gets right to the heart of the whole thing. You can have the smartest IT and legal folks on the planet, but if they cook up a security system that doctors and nurses can't actually use day-to-day on the front lines, it's going to fail. It creates this huge gap between the rules on paper and what happens in reality.
So, okay, we've laid out all these challenges. Where do we go from here? What's the actual path forward? How do we build a system that's resilient, one that can actually bend when it's under pressure instead of just shattering?
Well, the answer isn't just buying some new piece of software. It's a fundamental shift in culture. It means planning ahead and doing regular, realistic tests, just like that drill in Paris. It means getting IT, legal, and the clinical staff in the same room collaborating to make sure these policies actually work in the real world. It means training that's actually relevant to people's jobs, not just another boring slideshow. And really, at the end of the day, it's about building a culture where security is everyone's job, from the CEO all the way down to the person at the patient's bedside.
And all of this leaves us with one final, and I think really crucial question to chew on. As we rely more and more on all this tech in healthcare, we have to ask ourselves, are we actually building something that's meant to last, something resilient that can handle the inevitable shocks? Or are we just building a fragile house of cards? Honestly, right now the answer isn't clear at all. And the stakes, they couldn't possibly be any higher.